Every year, infectious disease affects the population of the United States more and more, and every year we are seeing an increase in sickness and mortality rates caused by infectious disease. The goal is to decrease the number of people affected by making sure that children and high-risk individuals are vaccinated against some of the major diseases, as well as bring awareness to chronic infection in order to help more people find a diagnosis and receive treatment. For example, if there's a disease that cannot be prevented, with a vaccine, early diagnosis and treatment is crucial, but the individual will only learn about these diseases with increased awareness and teaching. Infection control in hospitals can also help reduce the risk of infections in healthcare workers. So for the first objective, we chose to reduce the rate of acute hepatitis B, and according to the CDC, the way to do that is by implementing recommended pediatric and adult vaccine recommendations through education. So basically educating your patients on what the vaccine does, what hepatitis B is, and encouraging them to get that vaccine so they do not contract hepatitis B. The second recommendation was to find building capacity for states to collect and use a core set of data to help detect at-risk populations. So they recommend finding a place to collect and use data so then they can go around to the populations in that state and use the data that they collected to detect people from the population that might be at risk for contracting hepatitis B. Their third suggestion was to conduct prevention research to show how to best provide a vaccination, testing, and treatment as part of an intervention for persons who inject drugs. So they're suggesting that we conduct prevention research, and through that research, they're trying to find out how to provide a vaccine, how to provide testing, and how to provide treatment for an intervention for people who are injecting drugs, because injecting drugs, you're more likely to contract hepatitis B. Their fourth suggestion was to encourage unvaccinated individuals to locate providers and get vaccinated against hepatitis B. So again, with just the education and the encouragement from your provider to get vaccinated against this disease. And they had a little graph on their website, and it said that the CDC predicts that the number of estimated acute infections will decline from 21,600 in the year 2018 to 18,000 by the year 2023, which is about 3 years from now, and decreasing the cases to an estimated 18,000 will return the U.S. back to its lowest number of cases, which was in 2014 with only 18,100 cases. So our second objective was to reduce tuberculosis cases, and on the Healthy People 2020 website, it said that their target for new cases was 1.4 new cases of confirmed TB in a population of 100,000 people. And it said that the CDC invests $97 million in epidemiological and clinical research and to support health departments in all 50 states, Washington, D.C., Puerto Rico, the Virgin Islands, and the Pacific Islands. And here with this research and this funding, they investigate and report every TB case. They identify contacts and provide treatment to prevent future TB cases. And they genotype TB bacteria and test for bacteria resistance. And they ensure medical care, lab testing, and other services to TB patients to stop the further spread of the disease. And more than 80% of the TB cases are from long-standing, untreated, latent TB infection, and that comes out to about 13 million people in the U.S. have latent TB. And latent TB just means that they have been infected, they do not feel sick, they don't have symptoms, which means they can't spread it to other individuals. However, if those germs do become active, then they can spread it to other individuals. And on the website, the CDC said that eliminating TB is a dual approach between increasing testing and increasing treatment for individuals with the latent infection. So increase testing to see if you have TB and increase treatment to get rid of the latent TB before the germs become active and before you can infect more people. And it was said that TB therapy is anywhere from 6 to 12 months, and if the treatment is not completed, if you end it early or don't go to the full duration of the prescribed treatment, then the bacteria can become drug resistant and the patient could relapse or die, or it could spread to other family and community members because the germs would therefore then become active.
Okay, so I was in charge of making the patient teaching handout and also for the interventions. So I will start off with explaining my handout. So I just did it on the overarching topic of infectious disease and didn't choose to focus on a specific one. I just did the broad basics of everything. So, infectious disease, learn the basics and what you can do to help prevent the spread of infectious disease. And then, what is an infectious disease? Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Infectious diseases can be passed from person to person, transmitted by insects or other animals, consuming contaminated food or water, or by being exposed to organisms in the environment. And then I thought it was important to include what the common symptoms are for infections, and um, here they are. So, fever, diarrhea, fatigue, muscle aches, and coughing. It's important to have people know what the common signs are so that they can figure out if they are having an issue and then seek help so that they also don't continue spreading that disease. So next, it goes into following these steps to reduce the risk of infection: washing your hands, getting vaccinated, staying home when you're sick, prepare food safely, practice safe sex, don't share personal items, and travel wisely. And then I just have a little bit of information about each of those topics. And then I'm going to go into my interventions. Present. So our group chose to focus on tuberculosis and hepatitis B. So we'll start off with tuberculosis. So some of the important nursing interventions for TB are promoting airway clearance, and you can do this by positioning the patient to help with drainage. And the next one is following the treatment regimen. So carefully follow it. There's certain medications that are done and different treatments that are done, and following those is really important. And then also providing your patient with information on their meds and what's actually happening during their treatments, and just so they can understand what's going on and have some of that understanding is really important. Promoting nutrition and activity helps bring the patient back to their baseline health. And then what's super important with tuberculosis is preventing the spread of the infection. So it is airborne, and what you're going to want to do is teach your patient on how to cough, how to sneeze, how to properly wash hands, provide them with a closed container next to their bedside so that they can put in any infected materials such as tissues, and they don't spread around the room, and there's one space for them, and that can definitely help in preventing more spread of the infection. Having a negative pressure room, it helps with airborne diseases like tuberculosis from escaping the room and then affecting others. And then, as always, continue monitoring for any changes. any improvements or reasons to consider changing the treatment plan. Next, we have hepatitis. So the nursing interventions for hepatitis B encompass delivering medications, maintaining comfort, monitoring diet and hydration, and also patient education. So most often your patient's going to be on an antiviral medication, and you should teach them about what that means and just the basics of that drug. Next, you should help maintain their comfort. They may have nausea, and doing anything to help them feel better in those types of situations will be good. And then monitor diet and hydration, provide them with proper nutrition, and then monitor hydration by doing an intake and outtake of urine. And then patient education is extremely important with hepatitis B as well. So teach the client about transmission. So hepatitis B is mostly transmitted through blood. It's the primary one. So anytime there is like an open wound or there's some sort of incident where blood is outside of the body, make sure you use proper precautions for that, wear gloves, and properly dispose of any of the infected materials used. And also teach them that it can be spread in other ways, such as saliva, breastfeeding, and sexual activity, and try to limit all of those activities as much as possible to stop the spread of that. Okay, that's all I have.
Hi, I'm Maddie. I'm going to be summarizing some of the main points that Katie and Margaret have shared with us before. So again, our topic is infectious diseases, and our two objectives are to reduce the infections and the spread of hepatitis B, as well as reducing the infections and spread of tuberculosis. So some of the things that we can do to help with the objectives of hepatitis B are, while working in the hospital, we can use droplet precautions since hepatitis B is spread by bodily fluids. So we can wear masks, wear eye protection, things like that. And we can also encourage our patients and just people in general to get vaccinations against hepatitis B. That's one of the best ways that we can reduce the amount of infections and also the spread of the disease. And we can also do some client teaching, again, encouraging our patients to get vaccinated, as well as encouraging them to practice safe sex using condoms, things like that, because again, hepatitis B is spread by bodily fluids, and also encouraging them to get tested if they believe that they're at risk. And for tuberculosis, while working in the hospital, we should be using airborne precautions since tuberculosis is spread through the air by coughs and sneezes. So wearing masks, using negative pressure airflow in rooms of patients that have tuberculosis, and also again encouraging patients and people to get vaccinated against tuberculosis. And again, we can also do some client teaching, helping our patients understand what symptoms to look for, helping them know how and when they should be getting tested if they have an occupational risk of contracting tuberculosis, such as if you're working in a hospital or working with the incarcerated or the homeless, kind of any areas that you can have increased risk of contracting the disease. And then some generalized interventions for any infectious disease, having authorities notify the public, sending out health alerts, or having press conferences, and always informing the public on ways that they can stay safe, keeping themselves safe and others from infectious diseases. And lastly, how do infectious diseases influence us as nurses? So while working in a hospital, it is very likely that at some point we will encounter a patient that has some type of infectious disease. And so it's extremely important for us to understand what steps we have to take in order to prevent the spread of the infectious disease to other patients or to other people working in the hospital. What we can do to help our patients, whether that's, changing dressings, just making them as comfortable as possible, anything that we can do to help them. And we should also be able to understand how our patients might be affected, not just physically, but also mentally and emotionally. Anything that we can do to help calm them down, help any fears or concerns they may have about having an infectious disease. And also we can be able to perform client teaching, where we help our patients understand how they can stay safe from any infectious disease. And we also will be exposed to infectious diseases while working in a hospital. And so the Occupational Safety and Health Administration, or OSHA, has mandated that healthcare personnel must be provided with the opportunity to be vaccinated against hepatitis B at no cost. And that is a very helpful mandate that that administration has made, because working in a hospital, that does put nurses at an increased risk for contracting hepatitis B. So the fact that it has been mandated that all healthcare personnel are able to have access to a vaccination is crucial. It will help nurses stay safe, and also help reduce spread to other workers or other patients. As well, both the CDC and OSHA address the need for testing for infection with tuberculosis at an interval consistent with job risk. So basically that means that the CDC and OSHA both vocalized the fact that it's very important to be able to have testing available to people that are at an increased risk of contracting tuberculosis because of their occupational risk. Like I said previously, people working in healthcare, working with the incarcerated or with the homeless, those are just some of the occupations that put workers at an increased risk of contracting tuberculosis. So anything that we can do as nurses to help others stay safe and ourselves, those are all